Welcome everyone for our presentation about Kaiseris Permanente Nurses Knowledge Exchange Case Study on Design Thinking course. We are MA students of Arts of Education and Innovation of Webster University of Tashkent. My name is Ms. Suraiva Ekaterina. We have got also Rano Saipova, Firuza Tuicheva, and Shahnoza Hamidova. Let's start. I'm going to share my screen and we are going to start with our presentation. From the very beginning, very beginning. Okay. So what is actually Kaiseris Permanente? So Kaiseris Permanente is the largest nonprofit healthcare system in the United States. So this system, the system of branches that they've got in Kaiser Permanente, decided to think about innovative approaches, how to solve certain problems in their hospitals. They contacted IDEO to solve some of the issues because they couldn't do it on their own. Therefore, IDEO gathered an interdisciplinary focus group. This focus group started with a stage of empathy when they gathered all the stakeholders, doctors, nurses, and patients as well. They talked to them, they observed the things, how the things happen. The shift between the nurses was the major issue. Many patients felt the hospitals become ghost towns during the nurses' shifts because it seems like all the nurses disappeared and they couldn't find anybody. But this was the time when the nurses gathered in certain center areas and they communicated different information about the patients. So the IDEO group started shadowing nurses, of course, those who felt like comfortable about that, and observing how the process was going on. Also, they welcomed some of the nurses to become the co-designers. So because they also felt lacking some of the expertise information, how to organize the shifts and how all the process was working, that's why they needed the input of nurses into their work. On the define stage, there were so many different stages of mapping that problem because there were so many other problems. They were trying to put it into the core problem. What was the main thing? As many patients described the ghost towns, they also thought it's like a hole in care. Many patients felt like they are not being cared enough, and therefore the timing that the nurse shift took, it was about 45 minutes. And some of the information that was communicated was really in unreliable ways. Some of them notes were written in a very illegible handwriting. Some of the notes were not correct, and other notes were repeated, unnecessary. That's why the definition of the problem had to bring to the outcomes to decrease the nurses' time during their shifts, also to make the exchange information in a more reliable and safer way. But the third one would be also to help the patients to be the part of the process of communication, that information, so it would be visible for them. The next stage, ideation, is going to present Firuza.
Hi. Once they identify their problems to be addressed, which are the need to prepare for the next shift and the ghost town, the team members got together in the central location, Oakland, to generate as many solutions as possible, which means they moved from convergent thinking to divergent thinking. The team members were nurses, managers, architects, engineers, designers, and assistant nurses. They spent 2 days to generate more than 400 ideas. The goal was to get as many ideas as possible without judging if it's feasible or not. They were encouraged to view things from different perspectives. Some of the ideas were Genius Butterfly, Star Trek Communicator, Armed Computer Communicator, Plasma Patient Info Screen. However, at the end of this divergent thinking, they had to decide on which problem, on which idea they're going to move forward. So, which leads us to the next stage, which is prototyping.
Okay, hello everyone. So we are going on with the prototyping. As it was mentioned in the ideation stage, the team brainstormed over 400 ideas concerning the redesigning of nurses' schedules and the software they were using and the way they exchanged information about patients, and the most important, the way they interacted with patients. So in this stage, the team sees it from divergent to convergent thinking to come up with the solutions that would best suit NKE. So at the next slide, we can see that basing on these findings, the team created a framework that highlighted a new approach to the shift change problem solution, and the solutions were divided into periods of before and during shift activities that would ease the shift change and make nurses' time more efficient. Some of the solutions were not physical, but involved relation between nurses and patients due to a reformed schedule and better interaction with the patients. Now, at the next slide, we can see that through analyzing observations and shift changes, IDEO proposed to make the exchange of information next to the bedside, not in the changing room as they did before, thus to save time and not turn the hospital into the ghost town, as Kate said, during the nurses' shifting period. And also they encourage the patients to participate in the information exchange, ensuring better coverage of information. And all this procedure was called bedside round, when oncoming and outgoing nurses conduct a check with patients to ensure the smoother handoff between nurses. Now, at the next slide, there is one more solution. One of the solutions that they came up with was the installation of the care board. That was a board installed inside each patient's room with all their information, so the nurse could fit in during her whole shift, avoiding the waste of time at the end of the day. And with this board, patients could also interact and complement if any information was missing. So in the final stage about prototyping, we can see a new software that was implemented to compile the information in a basic format, a database called Neuron that will be used to help transfer information between nurses, and the printed report of Neuron, it is called My Brain, that will give nurses an access to patients' information. So this is it for the prototyping stage of NKE project, and I would like to invite my teammate Rano to introduce the testing stage. Thank you very much for your time.
So next stage is testing. This system was tested for 1 week session in 2 different hospitals in May 2004. And after 3 weeks, this was implemented first in South Sacramento, which is a medical center. Institute for Healthcare Improvement cited NKE as the best practice. Several non-KP hospitals requested NKE information. So KP decides to roll out NKE to all KP hospitals using rapid scale-up methods. They involved volunteer hospitals and also entire region. And as a result of this collaboration, within approximately 10 months, 12 more clinics were added to test this method. And in the next slide, we can see that larger takeaway was to understand the nurse's experience. This helped to define the core problem that is needed to be solved. And Christy Zuber, who is the member of Innovation Consultancy, she said that the NKE affects the way nearly 8,000 nurses engage with patients every 24 hours, 7 days a week within a year. And it was only in one hospital, and it spreads around the globe. And there are some other reveals. From testing stage, higher quality knowledge transfer was being made. Preparation times between shifts were reduced. As a result, this produced a much earlier and better informed contact with patients. That's it about testing.
So here is our reference list. And thank you everyone for watching.
Thank you.
Thank you. Bye.